name, pronouns, your affiliation, so what group you're coming from or whoever you're representing. And then our icebreaker question is, what is something that brings you joy? And so I can go ahead and get started, and then I'll pass it off to maybe our task force members first, and then open it up to our EJ unit staff and all others who are on the call. So my name is Lubna Ahmed. I am the Environmental Justice Boards Manager in the CDPHE EJ unit. My pronouns are she, her, ella. And in terms of something that brings me joy, something that's top of mind is food. I had some dim sum yesterday, and the amount of joy that I got from that meal was just unsurmountable. So it was really incredible. And it was something very small, lasted for about 45 minutes, but it was an immense amount of joy that sustained me throughout the day. So that is mine, and I will pass it on to Uni, one of our task force members.
Good morning, everyone. So Uni Blake, I'm with the American Petroleum Institute. I work community health issues, public health issues, environmental justice issues at the Institute. Real quick, what brings me joy? Take a wild guess by looking behind me. Yeah, plants and gardening. I garden like crazy, vegetables, fruit trees, you name it. That's actually a guava tree that's behind me.
That's awesome. Plants bring me lots of joy too, Uni, for plant ladies. Awesome. And then Beatriz, I'll have you introduce yourself, and then if we could just maybe just pick on somebody to go next, and we can start with EJ unit staff.
Hola, buenos días. Good morning. My name is Beatriz Soto. I use she, her, ella, and something that brings me joy is walking my son and my dogs to school in the morning. We had never lived in a place where we didn't have to ride the bus and we were closer to a school. So it's definitely an amazing experience to be able to do that every morning. And I will go ahead and pass it on to, so is it somebody from CHPHD, Lubna? It's only me and Uni from the task force?
Yeah, and so maybe we can pass it on to some of our EJ unit staff, like Joel or Rosario or Natalie.
Okay, I'll pass it on to Rosario.
Good morning, everybody. I'm Rosario Rossi. I use she, her, ella, and I'm the translation and interpretation specialist with the Environmental Justice Unit, and I joined back in November. And something that brings me a lot of joy is ragtime music. And I was very happy to hear a report today on Scott Joplin's music that was very interesting on NPR. I didn't know he had actually composed operas. And so that's definitely something that brings me a lot of joy, his music. And I'm gonna pass it on to Natalie.
Good morning, everyone. I'm Natalie Eddy. I'm the air quality liaison with the Environmental Justice Unit. I use she, her pronouns. Something that brings me joy right now is being outdoors with my friends and my family, playing in the snow. I live in Mudville. So this was a weekend of lots of outdoor time and actually seeing some friends I hadn't seen for years who I live very close to, but we've just all been kind of holding up, but coming out with the snow. So happy to be here this morning. And I'll pass it off to Joel. Sorry, Joel.
Good morning. That's okay. Joel Miner. I use he, him, el pronouns. I'm the manager of the Environmental Justice Unit, which means I get to do a little bit of everything and work with Lumna, Rosario, and Natalie in lots of different ways. Gosh, I don't want to duplicate, but Uni, I love plants and gardening too. So I think something that brought me a lot of joy this weekend is just running and getting to be outside. I recently moved to Wheat Ridge, and there's a beautiful park, Crown Hill Park, that I love running in. It's just feel like you're out of the city because there's such high kind of grasses along the side. So It's been bringing me a lot of joy every weekend and a good way to clear our minds as we do really important work during the week to get some time to be outside. So I think, Lubna, are we going to let everyone introduce themselves since it's a small group? And
Yeah, I think so.
okay, great. Well, then I will tag Christy.
Good morning, everyone. My name is Christy Richardson. I'm the state toxicologist with CDPHE, and I run our toxicology and environmental epidemiology office. My pronouns are she, her, ella. And, I think we're really happy to understand how we can support this subcommittee of the task force. We've been doing a lot of work with Joel's team, and I think we have run into numerous data challenges, and I look forward to thinking about how the task force can help us improve access to data, to meaningful data, to understand people's environmental exposures and their lived experience. So thanks for the opportunity for our team to help support this. In terms of what brings me joy, nearly every morning that we're all together, my 2 kids and the dog, we all snuggle on the couch together and taking just those few minutes in the morning, even though mornings are crazy. And if you have young kids, it's like, it is a nonstop battle to meet all of the school drop-off times and get to work on time and all of those things. But we always just take a minute or two to have that morning snuggle. And I'm really grateful, and it brings me joy every morning to start my morning like that. Kelsey, do you want to go next?
Hi, everyone. I am Kelsey Barton. I'm a toxicologist on Christy's team, and also have a background in environmental epidemiology. So I'm excited to help support and learn from this committee. And what brings me joy is being outside in the mountains with my dogs and my boyfriend and my friends. And I will pass it on to David.
Hello, everyone. Good morning. I'm David Rojas. My pronouns are he, him, and él. So I'm a professor at Colorado State University. I'm an environmental epidemiologist, and I'm very interested to learn about your approaches in terms of data, how I can learn more about data, and I'm helping CDPHE in terms of the Colorado Enviro Screen tool in this process, and I have been working with other type of tools for their stakeholders, try to translate epidemiological evidence to decision-making processes. So nice to be with you. And I will not be able to join the full meeting, but I will try to stick here a little bit more. Thank you. And I will pass this to Beatriz Soto.
I think Beatriz went, so let's send it to, yeah.
Hi, everyone. I'm Kelly Crandall, she, her. I'm an advisor at the Colorado Public Utility Commission. I'm just listening to support our director, who is our representative on the task force. Things that bring me joy, my cat, who we adopted in quarantine, who has gone from being super duper anxious to being just a sweet little cuddle machine. So yeah, thank you all.
Great. And I think we still have Christina.
Hi, everyone. My name is Christina Yabua. I work here at CDPHE as the maternal health manager. So I run the maternal mortality prevention program. And I also serve on the EJ advisory board. So super happy to be here and listen and learn from all of you. And then as far as what brings me joy, live music. So, the pandemic really stole a piece of my heart, not being able to go to concerts.
Mm-hmm. Yeah, I'm with you on that one. Great, thank you. And then I think we have one more person, Jared. Did you want to come off mute and introduce yourself as well?
Thanks so much. Good morning, everyone. My name is Jared Bynum, he, him, his pronouns. I am with Conservation Colorado. I'm their communities and justice advocate. So I'm hoping to use some of my capacity to participate in task force and advisory board proceedings, make sure we have a good advocacy community showing up for these things. And something that brings me joy, I guess, is my niece. She's 7 years old. We went to the zoo this weekend. It was like 34 degrees. She was so cold, but she was such a good sport. None of the animals were out. I just love spending time with her. She reminds me why the work we're doing is so important. Thank you.
Awesome, thank you. Great, well, thanks everyone for introducing yourselves and for taking the time to share what is something that brings you joy. It looks like we have one more task force member that we're waiting on. This is a smaller subcommittee meeting that consists of 3 task force members, Jeannie Blake, Beatriz Soto, and Dr. Sheila Davis. And hopefully she'll be joining us soon. But with that said, I wanted to provide a quick update on kind of what has been going on with the Environmental Justice Action Task Force up until this point. So this is the convening of our 4th subcommittee meeting. There are 3 other subcommittees that met earlier, well, not earlier in the month, that met last month now. The Best Practices for Community Engagement Subcommittee, which is led by Natalie, took place on January 24th. The chair for that subcommittee is now Ilda Nusete. The second subcommittee meeting that took place was on the definition of disproportionately impacted communities. That subcommittee is facilitated by Joel, and the chair for that subcommittee is now Ian Tafoya. And then the third subcommittee meeting that took place was on January 31st, and that was the Equity Analysis Subcommittee. That is our largest subcommittee, consisting of 14 people. And so because it is so large, we have 2 co-chairs for that subcommittee, the Equity Analysis Subcommittee. And those 2 co-chairs are Renee Milad-Chacon and Beatriz Soto, who is also on this subcommittee. And so one other thing that's worth mentioning is that the full task force was launched at the end of December. Our next full task force meeting will be taking place in just about 2 weeks here on February 22nd. And during that full task force meeting, there will be a share out from every one of the subcommittees to kind of like get people all on the same page about what's going on in these smaller groups. So that brings us to this subcommittee. Any questions before we get started? I'll go ahead and share my screen. Getting my screen set up here. One moment. All right. Okay, so welcome to the Data and Health Disparities Subcommittee. We have done our icebreaker, and I wanted to do a quick review of the agenda. I'm going to do just a review of our roles in terms of EJ unit staff and our task force members. And again, thank you to our advisory board members, as well as the folks from CDPHE's Toxicology and Environmental Epidemiology Office for joining and taking the time to participate in this subcommittee, and to everybody here. But I think that'll make this a really productive meeting and bring in a variety of different perspectives, since the subcommittee is so small, and we do need to narrow our scope during the course of the next couple of hours. So after touching base on our roles, I will just kind of share some general objectives, some guidelines for this subcommittee. You can call it a scope of work. We will discuss timeline, and then really a majority of this meeting is going to consist of a discussion. I'll kind of share some questions and would love to have everybody actively participate and kind of share either their opinions and their thoughts. And then we will elect a chair and talk about next steps and see where we're going from there. All right, so in terms of roles, to clarify, I am representing the Environmental Justice Unit staff alongside Joel, Natalie, and Rosario on this call. The 4 of us are in the EJ unit. We are your staff, so we are here to facilitate. Currently at this meeting, Joel is taking notes and Natalie is managing the Zoom. So if there are any questions that you have related to tech, or if you want something in particular to be like shared or dropped in the chat, please do share that with Natalie. Since I'm facilitating, I might be like less in tune with the chat. And today, to make today's meeting productive, because it is our first subcommittee meeting, we don't have a chair, and we've built in kind of the framework and exactly kind of what we're going to be reviewing. But for future meetings, that will be a collaborative effort between myself and whoever will be elected the chair. So we're presenting some ideas today. These are just some basic suggestions about what we think could be good ideas and point us in the right direction of like where we want the discussion for this data and health disparity subcommittee meeting to go. But you as task force members, and you know, in this case, I'm specifically speaking to Uni and Beatriz, but you know, you are really empowered here to present your ideas. There are a number of other people on this call, and this is a public process. So I do encourage everybody on this call to kind of speak up, share your opinions, and really express those opinions, not only to us, but feel free to express those outside of these meetings to Uni and Beatriz as well. And then also going forward, you know, just to be clear, we as your EJ unit staff, we are tasked with helping make your ideas happen. So throughout the year, you know, we will structure all of the meetings to incorporate these ideas and continue to create frameworks. Any questions around roles so far? Okay. So jumping right into it, before we start on our objectives and kind of our scope of work, one definition I did want to just put back up here is the definition for disproportionately impacted communities. We've shared this at our full task force meeting. Most recently, we shared it at our equity analysis subcommittee meeting that took place just last Monday. So Beatriz, this probably looks all too familiar to you. But I just wanted to review it for folks that might not have seen this before or just need a refresher. So the definition of a disproportionately impacted community, and this is coming from language in the Environmental Justice Act, which, as a reminder, is the reason why this task force was formed and why we ended up breaking down into these different subcommittee meetings. But the definition of a disproportionately impacted community in the EJ Act is identified based on three major demographic factors. And those three factors are more than 40% low-income households, more than 40% people of color households, and more than 40% housing cost burden households. Also in the EJ Act, the second identifying factor for disproportionately impacted communities are communities that have a history of environmental racism. And then finally, the Act identifies communities with cumulative impacts from many sources that contribute to persistent environmental health disparities. And cumulative impacts being the whole of different environmental issues or health issues that might be impacting one person. So say, for example, somebody who lives near a polluting facility that has pre-existing asthma and perhaps is, you know, a single mom working 3 jobs, taking care of multiple kids, you can kind of see how those factors kind of compound and form a cumulative impact. Okay, so with that said, and with that clarification around some of the language that you might see in some of these objectives, these are kind of the major objectives that are driving this subcommittee. So in terms of kind of like end goals and what we are trying to achieve, first and foremost, we want to draft a plan that addresses the lack of data and data sharing between state agencies about potential exposure to environmental hazards. Secondly, we want to make recommendations about how to improve research and data collection efforts related to the health and environment of disproportionately impacted communities. And then thirdly, we want to develop recommendations for establishing measurable goals for reducing environmental health disparities for disproportionately impacted communities. So these are, major objectives. This is not something that we're going to be tackling all today. These are kind of our guiding objectives for the course of the next few months as we continue to meet. And I'm actually going to stop and reshare my screen and just pivot to the language in the bill. And I thought this might be helpful for people to kind of see where this is coming from. If you just give me a moment to share my screen once again. So I want to do this quick screen share to really show you guys where the language that were in the objectives, where that exact language is coming from in the Environmental Justice Act. And you can either follow along on your own by clicking on the link to the House bill that Natalie will drop in the chat shortly, or you can follow along via the shared screen that is up right now. So if you look at the Environmental Justice Act, you'll see that there's a number of things in here, but something specifically related to the Environmental Justice Action Task Force. So on page 10, it says duties of the task force. And this is really the language that we use in here to break down the 4 different subcommittees. And I'll scroll down to page 11 here. And we're looking at this bullet here of section 6, which it says recommendations for establishing measurable goals for reducing environmental health disparities for disproportionately impacted communities, and then adoption of a plan that addresses the lack of data and data sharing between state agencies about potential exposure to environmental hazards, and improves research and data collection efforts related to the health and environment of disproportionately impacted communities, climate change, and the inequitable distribution of burdens and benefits of the management and use of natural resources. So this is language directly from the Environmental Justice Act. And when we were kind of looking at the wide variety of things that the task force is tasked with developing recommendations around, we were seeing 4 major buckets. So, and I talked about those 3 other subcommittees, but those 4 major buckets being equity analysis, that we clearly need to, figure out whether we want to develop an equity analysis, how we want to engage with communities, so best practices for community engagement. The 3rd bucket being really solidifying or reevaluating the definition of disproportionately impacted communities, which I just reviewed. And then lastly, we were seeing this major piece of data and health disparities. And so that is what's bringing us here today. And if you all want to kind of go back and look at that language, I welcome you all to do that. All right, so I will switch gears back to our presentation. All right, so we have our objectives back in front of us, and we have the context from the Environmental Justice Act, which I just shared. And I just want to kind of get us grounded a little bit in kind of why any of this matters at this time. And I know a lot of folks here are data wonks or are very familiar with why data is important, but just to get us grounded and make sure that we are all on the same page. And actually, before I do that, Sheila Davis, I just saw that you joined, and I want to give you a moment to just quickly introduce yourself, since you are an integral part of this subcommittee. Sheila, we started off with introductions just a few moments ago, and we just provided our name, our pronouns, and then our affiliation. So whoever you're representing, where you're coming from. And then if you would like to share the answer to the icebreaker question, which is, what is something that brings you joy?
Good morning, and I'm sorry for my joining so late. It's a crazy Monday morning. I am Sheila Davis. I am the director of the Office of Health Equity. My pronouns are she, her, hers, and I am a musician. So all things music I enjoy. Playing, listening, composing, all of it. I have a limited, I can only be on for 30 minutes today, though. I'm so sorry. I'm going to turn it back over to you.
No problem. Thank you, Sheila. And very cool that you're a musician. And Christina was just saying that that was something that brings her joy and something that she misses the most is live music. So you two should connect. Awesome. So Sheila, I was just sharing our objectives for this data and health disparities subcommittee and getting us grounded in why all of this matters. So at its very core, we know that data tells us what we need to do next. We know that data exposes inefficiencies or disadvantages. And at its core, data really reveals the truth. In our case, what we are seeing is that it really isn't enough data that is showing us exactly where the inequities are, and that these data gaps are not really allowing us to see the full picture. And so that's one of the things that we want to talk about. With this subcommittee, we're presented with an opportunity to make suggestions around that reality of data gaps and perhaps not seeing the full picture around inequities. And so that's really what we're doing here today is having suggestions directly around, how we can have, for example, the people in power who enact change through policy, they might be able to kind of shift that. I will also say that this subcommittee is different from the other subcommittees in that we have a specific charge. This one is like a little bit more broad and open-ended in terms of data gaps and how we measure health disparities, but how do we narrow this scope? What can we do in terms of, for example, choosing a group that is important, that we as a group here kind of sitting together at the table, who are the populations that we want to talk about? And we know that kind of some of this is a little bit ambiguous, but we are looking to you to help us narrow that focus and tell us what you want to focus on. This subcommittee is smaller than the others, and so I encourage you all throughout the course of this meeting to really take that as an opportunity to use this as an informal space and really discuss. And while I am facilitating this subcommittee meeting, I encourage you all to kind of come off mute at your own will if you have any questions or ideas or comments that pop up. Definitely please use the raise hand feature if somebody is talking and you have something that you want to say promptly right after. But otherwise, feel free to come off mute. And at this time, I thought we could have a conversation about how to tackle these objectives. And again, we need your help to identify areas where you would like to focus and narrow the scope of our work to a manageable scope. So with that said, the one other thing that I wanted to share is our timeline. Again, this is a pretty broad timeline, but I thought this might be a helpful visual. This is kind of our condensed timeline. Right now it is February. The thought is that we will meet regularly to address these objectives over the next few months. By June, what we would want is a draft of recommendations centered around data and health disparities, specifically for the subcommittee. And the end goal is that by November, those recommendations that we will produce in the early summer will be ready to be submitted in a final report of findings and recommendations that will go to the governor, to CDPHE, and to the legislature. So that said, one thing I just want you all to keep in mind as we're kind of going through this is thinking about how often you all want to meet, you know, whether those meetings are every 3 weeks, every 4 weeks, that's a decision that we should come to today. And we can kind of hold off on that towards the end of the meeting. And at this moment, would love to kind of get into an actual discussion. So one thing I will do actually is, or that Natalie will help with, is just copy pasting these objectives and dropping them in the chat so that you will have them to reference. I'll actually stop sharing my screen because I want us, as we're engaging in this discussion, to be able to see each other. Let's see here. Oh, sorry, just a moment. Okay, so as we're thinking about objectives, and again, Natalie has dropped those in the chat for you all to reference as we're kind of walking through some of this. But I wanted to kind of start off with, you know, what we think are the right questions or more specific questions to be asking here in order to achieve these objectives. Recognizing that these are 3 different objectives, at times they will intertwine, but would love to start off the conversation there. Is like, from your perspective, what are the right questions or more specific questions to be asking? You know, where do you think we should start in that sense? And so I would love to open up the floor to whoever has any kind of thoughts or ideas. And feel free to come off mute on your own or raise your hand. So what are the right questions to be asking? Some more specific questions to be asking to achieve some of these objectives. And again, we're looking at the lack of data sharing, improving research and data collection efforts, and then establishing measurable goals.
Can I just say something really quickly before we start?
Yeah, absolutely.
Lubna? So I just wanted to share that I'm on the subcommittee because I've been in a lot of meetings with commissioners, elected officials, and community members where, you know, they come up and it takes a lot of effort from their time and a lot of courage, especially for disproportionately impacted communities, to show up into these spaces and share reports of asthma and headaches and bloody noses and having to go repeatedly to the hospital, how expensive it is, and just show these heartbreaking stories with our electeds and our commissioners, and they respond, where's the data? Your lived experience and what is happening to you on a day-to-day basis. On top of that, dealing with racism in schools because your kids are not going to schools and having different moms that are being targeted as not, you know, being good moms, taking their good kids to school and not understanding that they are facing environmental racism, and then going in front of an elected official or a person in a position of power, and they telling you, there's no data. All that you're telling me, all this experience that you are sharing is something that is coming out of the blue, you are making it up, and there is no way or place where you as a person experiencing this can show in proof that this is actually based on environmental justice, and it's because of the environmental pollution that is around you and your family for generations now. So I just wanted to like set the tone that I've been in so many spaces where they tell community members that their experience is not real because they are not showing up with the proper data. So as we're thinking about this, I want to think about how do we put the tools in the hands of those communities as well. So when they go to these spaces, they can just be like, here you go. Since my story is not true, since you do not believe me and you do not believe that I am suffering and my children are suffering, if this is what you need to see, I have quick and easy access to validate my experience because it is only through data. So thanks again.
Yeah, thank you, Beatriz. And I think those are critical points to bring up, right? This is the Environmental Justice Action Task Force. We are trying to, you know, create as much action around the EJ issues in the state as possible. And I think those are incredible points to bring up, is the EJ stories, the lived experience of people, and how we can get the data connected to those stories to ensure that their voices are amplified and that people can point to something and be like, this is the proof. If it has to be quantitative, this is the proof of, you know, what is happening. David, I see you have your hand raised.
Yeah, thank you. And thank you, Beatriz. I think this is very, very helpful to understand what are the needs in terms of data. And something how I see this kind of objectives, definitely you have a lot of different objectives, and there are different questions that we should be asked to actually arrive to those objectives. And the first part is a lack of data. Probably the first question is which kind of data we actually need to find the gap or the lack. So we need to know what are the data needed. So this is the first question we really need to ask. What kind of data is needed and or required? And I will say that required probably is not the best way to move forward, and it's more that data is needed. And the other point that I wanted to bring is in terms of measurable goals for reducing environmental health disparities. So in disproportionately impacted communities. So I think those goals are based on specific indicators of those data, probably is a easy way to measure. Of course, the question is here, how often and how this data will be collected. So to actually track that changes on time, you need several measurements on time. And risk perception often is related to short-term impacts, but sometimes the health burden is related to long-term impacts. So we need multiple years to collecting the same data to actually see a pattern. And probably the other point that I wanted to bring is that reducing is too big for me. And as a public health practitioner, I will say we need to eliminate those, not reduce those, because I have seen that in many other settings that authorities and stakeholders want to go in the right direction into reduction, but it's too slow, and we are missing time and opportunities to improve health in the communities if we don't go faster. So I wish we can set some goals to be very ambitious, even if we are not able to achieve those goals. If we are ambitious from the starting, probably we will be more near to improve health. And if we are not able to change wording here, but at least we can say it like we should at least half of this kind of exposures or problems in the coming 5 years or 2 years, and then we have half the other or eliminating in this other period of time, another 2 or 5 years. I think this is a very ambitious, very crazy, but we need to be very ambitious here, and we are missing health. And many of those cases of disease, hospitalizations and deaths are preventable. So something that we can avoid if we have the proper tools. So again, probably I will say we need to be very ambitious, and then we need to start to thinking about which kind of data we really need. And when we want to ask the question about lack of data, so what is the data needed? And I will stop here.
Yeah, thank you, David. Between you and Beatriz, this is an excellent start to our conversation. Great recommendations around changing the word reducing to eliminating. Again, this is a subcommittee that is open to the public and that our task force members are driving, and we can 100% change the language of these objectives. Again, this is something that the EJ unit staff has drafted up based on language in the Environmental Justice Act, but the direction in which you want to take this data subcommittee and how you want to present recommendations around data and health disparities to the governor and to the legislature is entirely up to you. And so if we want to kind of be more firm and say, you know, eliminating health disparities, environmental health disparities, as opposed to using a word like reducing, we can definitely do that. Also, you bring up a really good point of establishing kind of some parameters, right? Timelines. When we're talking about measurable goals, we need to figure out what is our timeline that we're working around. And this can be tricky, right? Because we can talk about, you know, 2 to 5 years, but then, you know, we're presented with the issue of cumulative impacts, right? How do we address cumulative impacts when we are looking at a shorter timeline? So stuff that I would love to continue discussing. Kelsey and then Uni.
One of the things that I think we need would be a helpful question to answer as we thinking particularly about the first objective, data sharing between state agencies, is what is the current universe of data that exists within all of these different agencies across the state and within CDPHE, and is it currently accessible and transparent in a way that we can use it? And if there's certain agencies that are collecting data that may be useful, but in the way that they're collecting it right now, it could be improved. How can we communicate with those people who are actually already collecting data to improve the data so that's more useful for the questions that we're trying to answer?
Yeah, excellent questions. Kind of what is the world of data that exists that we're looking at, and who are the collectors? Great questions. Uni.
Actually, Kelsey just kind of spoke to what I was saying, you know, in terms of what data sets exist. I started by looking at the EJ indices, you know, that the state has come out with, and those data sets are, they seem like they're national level data sets. Can you guys hear me? I know my internet's bad.
Yeah, we can hear you. And if it feels like it's getting choppy, feel free to turn your video off while you're talking. Usually that helps.
Okay, I'm gonna turn it off. So, yeah, so just doing an inventory of all the different data sets that are already out there, and then thinking about the different level of granularity within those data sets. When you talk about environmental justice, it's more of a community level concern. And some of these data sets collect data at a regional level, which doesn't really capture the nuance of what's going on in a specific community. So I think that would also be a good exercise to do if we could see those in front of us and then make a decision beyond that. And then I think something that Beatrice brought up was understanding how the data sets we're collecting meet the needs of the community. The community needs are slightly different than what's needed to identify an environmental justice community. So do we have the data sets that they need? I mean, is there a way to find out, we do have a lot of representatives from different community organizations, what specific data sets do they think would be most helpful for them, you know, as they're going about advocating for their health issues?
Yeah, absolutely. Thank you for those additional points to what Kelsey said. And so, yeah, you bring up a really important piece of what are the environmental justice concerns and data collection that community members themselves see as important and want data to be collected around. And yeah, we do have representation from communities here, and we will get into kind of who else we need to have in this room here and hear from in just a moment. But I do encourage everybody here, if there are communities that you feel should be represented here, please do help us with our our outreach and share these meetings with them so that they can participate as well. All right, thank you all for your thoughts so far. So this kind of naturally takes me to a question of what are existing resources that would be helpful for this group to review or analyze together? I feel like between the folks that are in this room, we know there are a lot of different data collection sources, different ways to view data, but they might be kind of separated. And so why don't we kind of take a moment to share where those existing resources are and what would be helpful for this group here. Again, as your EJ unit staff, there is some legwork that we are happy to do between these meetings to kind of create some clarity. But what do we want to, what resources do we want to kind of review or analyze as a group together here? And David, I see that you dropped a link in the chat. And I think the first link you dropped, okay, so the second link you shared is a workable version of that initial link you dropped.
So I dropped it.
Oh, sorry, okay. Yes, Sheila, thank you for dropping that.
Yeah, so I think it's important to come from an assets perspective. So much of this work is done from this deficit, a deficits framing, blaming people most impacted by environmental injustice. So I really like the assets framing, and the PDF explains it. So I would encourage all of us to look at it and decide if this is something that we want to use in this work.
Sheila, if people don't have a moment to kind of look through this resource, do you want to just share a little bit about it, just verbally, in terms of kind of what you're thinking in terms of a vision?
That we identify the strengths and aspirations of communities, and that yes, you include the challenges, but you honor the dignity of people and their gifts, and that is so often not part of the narrative. It's this blaming of people for circumstances. And so assets framing, I mean, it's really about shifting the culture and changing our mental models. And so when you read through this document, and it's like 3 pages, it's not long, it offers some examples of how you do that.
Awesome. Thank you for sharing and clarifying that. Yeah, and very, very important distinctions to make, right? About how oftentimes health disparities and negative health outcomes, the blame often is put on the community itself, which is an injustice that we know all too well. So that is a really great way to kind of frame this conversation.
I mean, we hear about low-income people, as if their identity is wrapped up exclusively in how much, their assets, and it doesn't account for circumstances at all or historical injustices, and so that's the strength of one of the strengths of assets framing.
Yes, thank you. And Beatriz, I think the second link that Sheila dropped in the chat is a workable version of the first one, right? Okay, great. All right, let's continue having this conversation. So the other question I had asked, what are existing resources that would be helpful for this group to review or analyze? Any thoughts around that? existing resources. And I know that there are a number of environmental justice screening tools, and maybe David, if you would like to speak to that. But there are a number of different tools out there. Where do we want to start? What are kind of, we've established that, okay, maybe one of the things that this group needs to do is look at what the existing sources are, and figure out kind of who is collecting that data. And so those were great starting points, but how can we kind of specify even further? How can we narrow our objectives even further? Yeah, Christy.
Well, I think one of the things I've been thinking about is the challenge that we have, and folks speak to this often. We go into communities and talk to community members about their lived experience, and things like headaches and nosebleeds and things like that. We don't have great data on that because we don't have a great way to track it. And so I think we have a lot of data on the environmental exposures, right? Because different regulatory agencies have to monitor for different purposes those exposures, right? So they do that to varying degrees, but theoretically we're monitoring drinking water, we're monitoring ambient air, right? So we've got some data sources there from the regulatory perspective, but it doesn't always capture the scale at which we need that information, right? So regional air monitors are set up across the state to capture regional air quality, but it doesn't get that community based. So I think, it would do us it might be good for this task force to think about the data that is available and whether it meets the scales. And I think the EnviroScreen tool that David and the CSU folks are building could be a great resource. I think in terms of the sort of health side of it, again, we rely on data sets that are available to us. And so hospitalization data or insurance data is something that we can, I don't want to say readily, but can get our hands on. Whereas if it's not going into a database somewhere, right? If it's someone's lived experience, there's no way for us to capture that and track that information. And, I talk to communities all the time about nosebleeds. And, I think a big question that we all have here in Colorado is, how often do people get nosebleeds? Most of the time, they're not being hospitalized for those nosebleeds. And is it different in different places, right? How can we identify the health disparity if we don't have that data? And so I think part of the challenge that we have to identify is what data is available. Is it available on the scale that we need it? And are there mechanisms to collect additional data that would allow us to identify whether the lived experience or the health impacts that aren't being tracked through hospitalization data or through insurance data can be, that we can aggregate that data somehow and identify where those disparities lie.
Yeah, thank you. Great points. And, that I think this speaks to kind of the world of data that is out there and kind of how much there's frustration around kind of what can go unreported. And Christy, you brought up the example of nosebleeds being a really common occurrence and could be an indicator for other health issues in the community. So thanks for sharing that. Any others have, oh, sorry, Uni, go ahead.
Now, I liked where Christy was going with that. I think another challenging thing is, even if you have that data available, it's hard to interpret for somebody to go in there and really think about what are they looking at or what are they looking for. Some of that exposure data, you have like fence line monitor data that's available to the public, and when they look at it, it's difficult to interpret what it really means. And so maybe having some kind of interface or way that it can be translated a lot easier for for easy, dissemination of information. Just a thought I had another thought, but now it's gone, just my luck. It's Monday.
Yeah, it's all good. And anytime that it comes back to you, feel free to just come off mute and share.
Yeah, I need to take notes while I'm thinking.
Yeah, of course. Right. So Uni bringing up the point of, even if there is data available, kind of the interpretation piece for like someone to go in there and like really understand what they're looking at. I think that's especially important, especially for our community members and having this make sense and to the people who are most impacted, right? And having them being meaningfully involved and not having data be this, I think data is actually a very intimidating word for many people. And so, thinking about that too, right? How can we break that down? Any other thoughts around existing resources that would be helpful for this group to review or analyze? I know we mentioned EnviroScreen. Are there others that people on this call would like to mention?
Lumina, I wanted to quickly take a moment and kind of answer Beatriz's question from the chat and just say that, yes, I think we can, as your staff, work on sort of providing a list or an inventory of kind of some of our existing databases and screening tools and have that available at the next subcommittee meeting. That type of kind of specific homework assignment is actually really helpful for us to know how we can support you. So thanks for flagging that, Beatriz.
Yeah, and one other thing I will mention is that Jorge Figueroa, who is on our Environmental Justice Advisory Board, kind of asked this question of, hey, is there somebody out there that could do kind of a comparison of the different environmental justice screening tools that exist? Because there is a number of them, and kind of showing what data is being collected and kind of showing the differences and like overlap between those different tools. That's something that David mentioned that he would be able to help with as well, and share out at the next advisory board meeting, which is happening in April. So I just wanted to mention that because that is something that we will be preparing for in the next few weeks, is kind of that comparison. And I think that'll be useful for not only that advisory board that requested that, but to this subcommittee and to the greater task force. Kelsey and then Uni.
Just a couple of other potential data sources that might be helpful. Some more health data like NHANES. We could leverage some national data sets. Our NHANES stands for National Health and Nutrition Examination Survey. It's collected by the CDC every other year. It is supposed to look at representative survey of Americans. And then there's some other state data sets, the briefs, BRFSS, and the SHEDS, and I can put these all these acronyms in the chat too, that exist, that might be helpful to look at and see if they can answer some of the questions.
Awesome, thank you, Kelsey. And yeah, feel free to drop those, all of those tools and resources that you mentioned into the chat, just to make sure that we fully capture that. Uni.
I remembered what I was thinking about. I did a really fun exercise, but I know it's been used to a greater extent, is using Google Trends and the information that people are searching for. But this is, this is a little bit different because I know internet is a challenge in a lot of areas, even where I live. But Google Trends has a really good can predict like the flu. I know there's some work out there that has been done around the information that people are searching for. I did a Google Trend analysis for nosebleeds to see how well it correlates with industry activities. And so something like that, is sometimes useful.
Awesome, thank you.
Just a novel way to think about data, a different way to think about those big data sets that are out there.
Okay. Yeah, and then Uni, in terms of kind of how you utilize that tool of Google Trends, do you want to share more about that? We can also talk about it kind of offline, and we can set up like a one-on-one to dive more into that. But is there anything that might be helpful for, generally for the public to know about kind of how to potentially use that?
So like, for example, if you have if a state sets up like a hotline, I don't know if Colorado has a hotline where people can call in. I'm now specifically talking about the oil and gas industry and people that live close to proximity to oil and gas. Some states have hotlines where they can call in and report a symptom or type a symptom in. And that data set can be kind of trigger a secondary action by the state looking to see, is this like something common at this point in time? So for example, Google Trends has actually been used to figure out, like for food poisoning, social media can be used to target, like if there's a food poisoning issue going on, because people tend to type in stomachache, throwing up, heat sweats or something like that. And so you can capture that trend just by tracking what people are searching for. And so if there's a correlation, then maybe it's another tier that can send you now into the field to collect a different level of data. I'm just thinking of in terms of like triggers, triggers. Like if all of a sudden you got people calling in the hotline at the same time, it flags the CDPHE perhaps to take a closer look. But also, searching through Google Trends might be another way that may trigger, somebody to take a look. I mean, it's different. It's probably potentially a way that people have never really thought of using social media, but there's some work out there that I can share with you. Yeah.
Awesome.
Yeah, because even Twitter, people, there's some research done around tweets on certain topics, that then you can realize, okay, there is an issue when everybody's tweeting, can you smell that? What's going on, and, things like that. So.
Yeah, those are really, I'm like excited to hear that those tools exist, and, thinking about how to use like feedback from the general public, when people are sharing information, and this is kind of going to, it might not exist in an existing data set yet, but the fact that there is a trigger, that there is, something that is trending, that is coming directly from community members. Yeah, very, very important point to make. Kelsey, then Beatriz.
I just wanted, as we're talking about a hotline, I just wanted to say that the Toxicology and Environmental Epidemiology Office does have both an oil and gas hotline and a general environmental health hotline, and we do record people's concerns. So we have a general sense of like what people's main concerns are and what communities they live in. So I just wanted to say that the state does have that, whether or not it's like known about widespread in these communities, or whether or not that could be a potential resource for this group. I'm not sure, but it does exist.
Okay, great. Thanks for clarifying that, Kelsey.
Can I ask a real quick question? I'm sorry to interrupt.
Go ahead.
To go back to her, to Kelsey over there. What do you use that data for? I mean, how do you use that data? Does it, and I saw Christy put on her camera now too. Does it trigger an action, or does it trigger something within the state, or?
So, I think this is a pretty nuanced conversation. So we have, under the chronic and environmental disease reporting rule, environmentally linked diseases should be reported to us by healthcare providers and labs, regardless of whether they're specifically identified. For example, elevated blood lead levels are specifically identified in the rule, but also any other disease that's known or suspected to be linked to environmental exposure should be reported to us. That being said, we don't get very much reported to us, aside from the things that are specifically called out in the rule, like lead and mercury. And I guess we do get, probably every summer, we get some folks that are reporting disease from algal toxins, rashes and sicknesses from algal toxins too. So with regards to oil and gas, we have specific
program that was set up by the legislature to respond to those concerns, and we go out and conduct various types of investigations related to those concerns. For all environmental disease, though, we don't have specific funding structure to conduct the same level of investigation as we do for oil and gas health information response program. So for that program, the types of investigations we do differ, but we do, if the team has the resources and warrants, and the concern warrants investigation in the field, we have the ability to go out and collect ambient air samples and things like that. We don't have those same level of resources for every environmental disease. And I think that's where we often run into challenges, because of the fact that our partner agencies that we work with, the various environmental divisions, are essentially they're resourced to conduct regulatory work and not to conduct these environmental health investigations. So most of the time, our response to general environmental concerns is providing resources and connecting folks with local public health who might be able to do some investigations. But it is a very resource constrained investigation that we're able to mount right now.
Can I follow up with a question? Yeah, so I'm wondering if this is the data set that that we're being asked to start thinking about how we can build up on that specific data set that Christy's talking about, like broaden it beyond just oil and gas, but also consider, environmental justice communities as well.
Yeah, absolutely. And I do want to encourage us to kind of think beyond just oil and gas, because there are a number of other factors, right? There's, water, air quality, soil. We want to kind of focus on all aspects of environmental health here. So while it makes sense that the conversation we're talking about oil and gas, and that should certainly be included, but being mindful to include everything else as well. Beatriz, and I also I encourage folks to continue on this stream of consciousness as people are coming off mute. I don't have to call on everybody, as like I can kind of step back as the facilitator and think about yourselves at a round table. And if you were just having a natural conversation, I know it's hard to emulate that when we're like on Zoom and in the virtual world, but yeah, feel free to just kind of come off mute and chat with each other. Beatriz?
Yeah, I wanted just to kind of emphasize on what Uni said on how do we design data sharing to where people, the platforms or the methods that people are actually using, and not expect your average person to go use our tools that are not meant to be user friendly. And how do we think about this as like a human-centered design as well? I think that's like what David was saying earlier, is like, let's be aspirational and let's really think about, what, even if we don't get everything we want, what would be the ideal world? And I think allowing people to use their phone or whatever tools that they have on their disposal that they already use to make it as easy and possible. We have technology on our side, so I feel like we have no excuse to not do the best possible and most equitably think about access and equity and access to information as well, and how does that look in data sharing. And then the other thing that I also wanted to share is I was working with the University of Berkeley on an environmental justice screen tool that they were using, and they wanted to connect with health. And I feel like when we look at disproportionately impacted communities, they don't use the health system in a traditional way. They don't use, these hotlines in a traditional way. So it's like these communities are already on the fringe of society. These communities are already overburdened with work. They don't have health insurance, right? They don't have the language access. It's going to be so much harder to get this information out of these communities without a lot of investment in education. And then how do we also think about citizen scientists? And how do we engage our own community in collecting information, empowering our own communities to be collecting data in the short term and the long term and be a part of the process, where it's not these disconnected agencies that nobody has a relationship with that are in Denver, yet we're in Western Colorado, right? And how do we help to start connecting that as part of this process and the data collection as well? And then the other thing, I just had a lot of things to say, is that part of I think what you were sharing with us with the language in the bill is climate as well. So I think it's like, how are we incorporating determinants of health, access to the outdoors, vulnerability to climate change, to heat islands, to all these other things that we know will add to the cumulative impacts of communities that are already facing environmental racism, and how do we bake in those components and that science and that information as well, nature loss, right? All these health determinants that we know impact communities into that as well. And then there's another phrase in there of who has the burden, the brunt, and who benefits from these industries. That's like another part that I'm like also thinking, I'm like, wow, I wonder if we mapped who has the health consequences of certain industries and where are the majority of those benefits, to see if those benefits are actually in those communities or if those benefits are somewhere in Texas or somewhere elsewhere, to like really be able to be like, oh, you know, all this oil and gas industry or all this transportation industry, the majority of the benefit of it is accumulated in these communities. And I'm curious to see if they have the same environmental, they're facing the same environmental injustices as the communities that are actually facing the brunt of that type of operation and don't get the benefits from it. So maybe that's very aspirational as well. I want to see the stark difference between those two.
Yeah, well, we're talking about aspirational things here in terms of you know, improving, you know, data collection and addressing data and health disparities. So all of your ideas are more than welcome. You brought up some incredible points. You know, the community science aspect of this, right? Like, is that something that we want to address here? Is that something we want to insert into our recommendations, right? Like thinking about how community members can engage in data collection efforts and how that can be validated, how that can be used. And then, yeah, Beatriz, thanks for reiterating and kind of looking at the language from the bill that I shared earlier and reiterating the climate aspect of all this, right? It's not just kind of right now in environmental health, which, you know, sometimes we kind of lose sight of the big picture of all the climate change impacts that will continue to, you know, negatively impact our disproportionately impacted communities. So that is a really great point to bring up. And I love the idea of kind of thinking about this visually and thinking about who is burdened, who is benefited, kind of almost looking at it as like a data power map of some sort. I think, you know, having this group think about things in that way is really helpful, because at the end of the day, come November, we are sharing these recommendations with the legislature, and this is going to be black and white text, right? It's going to be on a piece of paper. And so what can we do to really get the message across? And I think having kind of going a step beyond and not thinking about this as this like 2D document, but like thinking about ways that we can make this visual and share this with, you know, more people than just who this is being presented to, but kind of thinking about the community all along the way, right? And thinking about what will be useful to them and this display of data. Do others have thoughts? I mean, I think these are really great starting points in terms of kind of resources that we want to use. I think the EJ unit staff here has a lot of homework already cut out for ourselves. But I want to, you know, keep the conversation going. So any other thoughts about existing resources that would be helpful for this group to review or analyze together? And if not, we can kind of continue in a different direction. Other resources that people want to bring up and talk about? Yeah, Uni.
Me again, I apologize. Um, to kind of go back to what Sheila said, I think she dropped off, is they are, I'm not sure how to say this without sounding, what are some of the, like, I can't even think of a specific example, but things that that can be augmented or, made better within a community, like, when you talk in terms of, me, I'm a toxicologist, obviously I was thinking in terms of risk benefit, is there anything on the benefit side that can be leveraged in this conversation, or something that that we can recommend in terms of data? Let's analyze this data. How can we improve this specific indicator, a positive indicator that we could improve? I don't know how else to put it, I can't think of a specific example. I think I just have to go think about it a little bit more. But when we talk about it's this whole negative conversation that we have sometimes, and sometimes is that there's some kind of strength in that community that we can support, or that we need to identify and capture somehow. So I'm just putting that out there so that people can think about that, as another potential data set.
Right. Yeah, that's a great point to bring up, right? Kind of thinking about what is something that is benefiting us already. Oftentimes, like, we're thinking about starting at this like baseline, like, oh, this is not working, but something that is working, that is really highly functional, and how can we improve it to encourage, to ensure that it's continuing to do so, and we're bettering the tool along the way. Great point. Any reactions to that, Beatriz? Feel free to come off.
Yeah, Uni, that is such a good point. I want to highlight that when COVID hit, as a member of a disproportionately impacted community, we realized that the government had no trust with our community. They didn't know how to outreach to us. We didn't have relationship with our local hospitals and clinics. And they went to a method where they deployed thousands of promotoras, right? These are community liaisons that community already trust, and they were paid. And these weren't even like super high salaries, right? To go share resources, share information about COVID, and like really deploy the assets that we already have in community, the trusted members, to start education campaign, resource campaigns, collecting information of who got COVID, right? And starting to do that work. And that's just like a little example of the assets that are already in our community and the tools that we don't tend to use and think about. And again, it's just a quick example, right, of how in case of an emergency, when there is urgency, we have the tools on the ground, and we can teach people to collect information and to think strategically about, what our priorities are and why is this so important for these communities. And I think we'll have great response. And I think we can even have examples like Cultivando, right, that are already doing air monitoring in their own communities. And how can we employ these models kind of at a broader scale? And I think we can see some of that infrastructure with COVID.
Awesome. I think we have our first recommendation from the Data and Health Disparities Subcommittee. That's awesome. Yeah, I think those are incredible points to reiterate and mention that we have existing tools that should be leveraged, and again, kind of valuing, prioritizing the work that is already happening in the community voice that is coming out through those resources. Other thoughts or reactions to that? Christiane, I saw you head nodding a lot when Uni was sharing. Any kind of things to share around kind of tools that are working that maybe could continue to be improved, that could continue to help us?
Well, I guess I have I feel like I'm like Uni and Beatrice at this point. Every time I talk, I'm like, I have a million things to say, but
this is a small group, so I encourage everybody, don't hold back. I mean, Uni and Beatriz, right now, you are 100% of these task force members that are here. So I am expecting you to take up a lot of space. So please.
So I one thought was, I think whenever we go into a community and start talking to the community, we find things that are working well, whether that's like that they really do have, you know, a great ability to share culture amongst themselves because they have such a concentrated community in that area of people who have the same culture as them. So I think there are always, that was just one example that came to mind immediately, but I think there are always benefits that we see in these communities and we don't recognize them. So I do think it is going to be important for us to acknowledge those and see how we can take advantage of those benefits to keep moving things in the right direction, or sort of as a jumping board, right, to get things going. The other thought that I had was related to sort of these lessons learned from COVID and sort of a lot of resources that we have built up in the pandemic response, not just the promotoras, but the buses that we have that were deployed to do vaccinations, right? Can we repurpose those buses to go into a community and do surveys of community members to collect data on their lived experience, right? Or can we take advantage of sort of public health nurses that they've deployed across the area to, when we do see a concern in the community, to respond to that concern and collect information from the community members. So how can we be responsive to those concerns when they come up? And are there tools and resources that we've brought online as a health department from the pandemic that we can keep moving forward and redirect to these other probably, ongoing concerns in different communities in a way that will allow us to build off of the rather large resources we got from COVID, right? So like, it seems like a huge lift for us to say we need a whole new investigation program to go out and investigate environmental health concerns. But if we can say, okay, well, we already have this baseline of resources that was set up for COVID, let's just repurpose them. It might be a lesser lift to get the funding to move in that direction. So I think that was just another idea I had about the promotoras and sort of these lessons learned. How do we keep them moving forward? Because I do think we've made some great progress.
Yeah, excellent. I think we have another recommendation for our plan. So yeah, very great points, and kind of really thinking about existing resources. Great points about what has really resources that have come out of this pandemic, right? Almost like the silver lining around COVID. What are structures that have been built up? What are resources that we now have that can be repurposed to address environmental injustices, and kind of thinking about how they can be kept on and used in the long term. Joel.
Yeah, thank you for all these amazing ideas. I think I'm on page 9 of our note document, so it's been really wonderful to hear all these ideas flowing. And I just wanted to kind of quickly react to some of the last 2 points, and one say that I think what Christy was saying really underscores for me another advantage we have at CDPHE that we haven't really talked about, but we are one of the only states in the country that has a combined environmental and public health agency, right? Which is actually a huge asset that we can leverage here, where we have Christy's team and folks in our prevention services division, and the COVID response is managed here, right? And it's great that we're already coming up with ideas about how to leverage that sort of bureaucratic or organizational or agency advantage that we do have, kind of both sides brought together, which is unusual in most states. And then, oh my gosh, what was the other thing I was going to say? Oh, the other thing is, I can't remember. I think this is something Beatrice was saying, but when we're thinking about who these recommendations, your recommendations, are going to, like, some of it can go to the legislature, right? It can be like, we need a lot more resources, like money, to fund a response program, but the recommendations can go to the Environmental Justice Advisory Board too, right? You can tell the advisory board. So it was great that David and Christina were here earlier. The types of projects you should fund with your grant funding, because that's kind of one of the main roles of the advisory board is distributing grant funding, are projects that leverage or build support for existing community assets or something, right? So if there are specific ideas that you think would be, maybe better, that but are not necessarily have to be achieved through state government, but could be more achieved through support for organizations that we can give grants to. You can make recommendations to the advisory board to kind of shape who they're giving their grants to. So thanks for letting me come off mute to say that, because I've just been so excited listening to all of this.
Yeah, great. Thank you, Joel. Yeah, and thanks for reiterating that and highlighting the connectivity between the Environmental Justice Action Task Force and the Environmental Justice Advisory Board. Because these are two separate board bodies, I think we do often think about them separately. But you know, this is now February. Both boards were launched within the past like 6 weeks or so. And so I think it is at this onset as we're kind of getting everything geared up and you know, having these first meetings is like thinking about that interconnectivity and how we can really be involved in each other's work. And I think we've already seen an excellent display of that with advisory board members attending these smaller subcommittee meetings. And hopefully we'll continue to see that exchange. But this task force will essentially, you know, dissolve in November, and thinking about how we can keep the work of this task force alive through those recommendations that could potentially go to the advisory board, which is going to be, that's a permanent body. And so they'll be continuing to run the grants program, distribute grants. And so we can make recommendations directly to them, especially them being a board that is under CDPHE's Environmental Justice Unit. So great points to bring up. Kelsey.
I just wanted to piggyback a little bit off what Joel said about how CDPHE being both health and environment is a real asset. And I think that's true, but I also think that a lot of times the environmental programs who are collecting data don't realize, because they're collecting it for a regulatory purpose to answer a specific question, is this facility in compliance or not, or whatever. I think a lot of times they don't realize that their data may be used in other ways. And so the way they collect it is not always helpful to us, for example, in toxicology and environmental epidemiology. So I think that that's a really important to think about as we move forward, is communicating with these environmental divisions and seeing how they might be able to slightly change their data collection methods in a way that would help us use the data to think about some of the questions we're trying to answer.
Yeah, absolutely. Great, thank you, Kelsey. Any other thoughts here before we might shift gears and yeah, and any lingering thoughts? One other thing I wanted to you know, contemplate amongst this group and discuss a bit is who else we want to bring into these conversations. I think we have awesome representation here so far, but you know, we can, thinking about the whole gamut of people that are out there that maybe should be in this room. So you know, whether that be community members, you know, subject matter experts, you know, folks that you think would generally help inform or shape the conversation, we can invite those people to future meetings. You know, as task force members or even members of the public, you have the power to invite people to these meetings. These meetings are publicly posted. But if there are like general groups of people or even specific people that you want us to send, you know, communication to, let's talk about who those folks are and kind of think about who is missing from the room right now and who else do we want to hear from.
I'll go first. I'm thinking in terms of, you know, the folks in the state who collect air quality data. Just thinking in terms of, you know, sharing with this group a little bit more information about what kind of air quality data is collected. I don't know, is it through CDPHE? Because I know the toxicologists are here who utilize the data. But I think it would be interesting to know what kind of data they collect and where that data goes and how they use it beyond permitting data. Similarly with water quality data or how water infrastructure data, you know, that kind of data that has some impact on environmental justice issues. Mm-hmm. Christy turned on her camera. Okay, I'll be quiet now.
Well, I was just going to say that we've been pulling together quite a bit of that data for use in the EnviroScreen tool. And so I wonder if it would be helpful, Joel and others, if we share sort of some of the like documentation of the different metrics from in terms of environmental exposure that we're pulling together. I feel like I could spend, hours talking about this data and the limitations of the data that we get. But I mean, it might be good to just sort of pull those metrics together and highlight, what we are able to pull together and what we're not able to pull together. Joel, do you have thoughts on that?
Yeah, like as you were saying, I feel like it's not just exactly your last point. Like it's not just the data we did pull together, but like one kind of going through what are the limitations of what we did. Like I actually in the definition of disproportionately impacted community subcommittee, we went down a bit of a rabbit hole talking about just like how did we translate violations of drinking water quality standards into the data we're going to use as our drinking water metric. And that gets into like 5 different limitations in terms of like, how do you weight different types of violations? And like, where does a violation of sort of like a quote unquote paperwork standard that doesn't necessarily tie to a health impact, but could indicate a significant problem measure up compared to like a health-based impact, and then also just like the spatial limitations. I mean, there are huge swaths of the state that don't have a public drinking water system that are on well water. And then we don't have perfect data on the boundaries of public drinking water systems, and they share water across their boundaries, right? Like Denver sells to South Adams County. So, I mean, just there, but it's been months of work for mostly Margaret on Chrissy's team to work through this. And then, but not just like, that's just like one of our existing data sets. Like I think an even interesting and maybe more relevant conversation for this subcommittee is what about all of our great ideas we had at the beginning, or ideas we heard from the public for data we should include in EnviroScreen that we weren't able to act on because we didn't have the data, it just wasn't in the right form, or it would be too labor intensive to analyze. I mean, but some of our solid and hazardous waste facility information, if we did essentially what California did for California EnviroScreen, we would have needed a full-time person analyzing and crunching the numbers for about a year. Like, so I think like trying to share some of that out would be really helpful, because this subcommittee is one position to tell us how we can do better and make recommendations on sort of how can data be collected better. Just, how can we start sharing it better? And then second, it can also inform later iterations of EnviroScreen, right? Like the version of EnviroScreen we launch in June is not going to be the final one, and we're going to be working on improving it over time. So helping understand some priorities around data sets that we should be spending the time on to improve and use better, I think it would be great to get that feedback from task force too, because I think we need help knowing how to prioritize in terms of what's useful for the public and all of our stakeholders, not just kind of us at CDPHE. So I love that idea, Christy. It's a great topic for a future presentation, possibly by Margaret.
So I think Joe just gave himself an action item in that conversation over there. I think it would be helpful for us to, like Christy talked about, understand like the limitations that you have run up against. In all those different data sets that you have, if it can be summarized. I know it's probably, like you said, a very lengthy list. Maybe that's a place we can try and be a little bit helpful. I don't know if I know within of course, obviously within the agency, you guys are well qualified to figure those out, but we can certainly make some recommendations that could help, move maybe the needle, so that if the limitations are resource or related to resources and things like that, those are recommendations that this group could make. So.
I have another question, Joel. Is it really hard to also think of like people's access to health insurance in communities as well, and clinics, and think about it from that lens as well? And then also, where do certain disproportionately impacted communities work? because I know there's certain work environments that communities are already facing environmental or certain hazards. Like, for example, if you're a farm worker and there's a lot of pesticides, right? And then you actually go and drink certain type of water and exposed to certain type of air pollution. It's like, when we talk cumulative, it can be so many different factors. And I think it's really interesting. And I think the information is out there, where a lot of these communities actually work, what's their workplace environment, because I feel like every time we silo ourselves and all these different issues, it's like we don't get the bigger picture. So how do we also say, 90% of these communities work in warehouses that don't have air conditioning, right? And and they work X amount of hours or whatever. And I think some of that information is available, and I think that should be part of the cumulative impact as well. So it's we can get a better picture.
I know that question was directed to me. I see Christy came on camera, and I'll just say I think that's a great point of trying to think about occupational exposures and where they fit in. I'm now sad we didn't get Sheila for the whole morning, because the Office of Health Equity kind of has an equally ambitious agenda for this year to implement another law, Senate Bill 21-181, which includes sort of coming up with reports on many of those topics, including both occupational exposures and sort of access to health insurance, access to healthcare. And it's looking at it through a little bit of a different lens. Environmental justice is often very like place focused in the lens that that the Office of Health Equity is using is more focused on the differences among impacted groups, right? So they have a BIPOC working group, they have a sort of people with disabilities working group, LGBTQ people working group. So I think like they might not quite analyze the same information in a way that we could like build into EnviroScreen, but that doesn't mean that it's not super relevant in guiding our work in the environmental justice unit. So I can maybe follow up with some of Sheila's staff who are working on that project and kind of ask, I know they already have compiled a list of data sets on each of those topics. So see if we can bring those back to you for kind of future review and understanding how that information fits into our data universe. And Christy, I don't know if you have anything you want to add there.
Well, I mean, I think the challenge of bringing in sort of the occupational exposure is an interesting one that this cumulative lifelong exposure is something that, I think about in the middle of the night when I can't sleep. How do I conduct risk assessment to look at all of these things? How do we capture these things better? And I guess, there are some challenges because occupational settings are subject to specific laws and regulations that sometimes allow greater level of exposure than we would want community members to be exposed. And then I think also the other sort of gap in exposure is really indoor air. We don't regulate indoor air. And so our agency doesn't have great data on indoor exposures, but we know that things like gas burning stoves can expose people to relatively high levels of some of these contaminants that we're concerned about, like benzene. And we don't have a great handle on what that indoor exposure looks like. And then it makes it really challenging to look at someone's outdoor environment, just the air, for example, and try to assess risk from the outdoor ambient air if we know that people are spending half or more of their day inside, right? Or if they're spending half of their day at a different location besides the community air in their neighborhood, right? So it does make it really challenging. And I think it also sort of pushes us as public health professionals to think about, what can we consider as public health? And because that is focused on populations, right, versus individuals. So it'd be great for each individual to know, Joel, how did you spend your day every day, for the past week, and what were you exposed to? But then if we think about a neighborhood of people, how do we get that information for each person? And can we use data aggregated on, census block tracks or something to help us capture that? And is it going to be adequate enough to really understand the different experiences that individuals have? No great solutions, just lots of questions that come to my mind when we start talking about these things. Sorry.
Yeah, and that is often how we're going to start off, right? And that was one of the first questions. They're like, what are the right questions to be asking? So yeah, it makes sense that we would start there. I wanted to, sorry, Uni, were you going to say something?
No, I was just going to share the link, something that EPA is wrestling with as well, just for Christy. They just released a draft document screening for frontline communities, which might be interesting. And we're still waiting on them to release a guidance on cumulative impact assessment. So that should be coming out soon. That would be helpful in determining another data set that we might want to start thinking about getting to be able to do those cumulative assessments as well.
Thanks, Junie. Other thoughts around who we want to bring into these conversations, whether it's communities that are maybe not fully represented here. Again, any sort of subject matter experts that it would be really key to hear from and chime into this conversation, and just folks that we think would generally shape or inform what we were talking about here.
Are there any researchers that are focused in this area that have been doing some work? There's some really good schools up there, Colorado School of Public Health, that might be, my mind is narrowed obviously by the oil and gas work, but I do know there has been some work, where they've been looking at ways to capture this data that's not quantitative, the more qualitative data, like how do you get a metric on stress or something along those lines. I don't know if there's anybody who's doing that kind of work that could help, the conversation.
Yeah, and maybe Kelsey, Christy, or even Joel, if you have any thoughts there. I will just mention that we do have somebody from the Colorado School of Public Health that was potentially going to attend this meeting, but I think she had a commitment last minute. But Dr. Katie Dickinson, she's at the School of Public Health, right, Joel? Okay. So she is actually, her class is going to be working with us in the CDPHE Environmental Justice Unit. Dr. Dickinson's class, it's technically environmental and occupational health, but she has a lot of students who are interested in environmental justice. And I just mentioned that because that was something that I'm actually scheduled to talk with Katie later today about a project that her students could potentially take on. And maybe a thought for this subcommittee to kind of expand our capacity and, have her students with the guidance of Dr. Dickinson, helping us with, some sort of tangible project. So just wanted to mention that. And then Kelsey and Christy and Joel, if you have any thoughts.
Yeah, I was also going to mention Dr. Dickinson. I also used to work for the School of Public Health. So I have some connections in the environmental health department, but another person who does work related to environmental justice is Kathy James, and she works in the San Luis Valley and has worked in those communities for decades. So she might be another person who would be helpful to have on this committee.
Awesome, thank you. And Beatriz, I know you mentioned in the chat just like some folks that are clearly, or like community members whose voices may be missing from this conversation. Is there anything that you would want to like share more specifically about that, or like people that you think we should be inviting to take part?
No, I just wanted to add that I think we should think about partnerships with local colleges and even high schools, especially in rural communities where you don't have big universities and you don't have that infrastructure is readily available. And if we even see the environmental justice the screening tool, we can see a lot of these communities are rural communities. So how do we, elevate and use the assets that are in those communities as well as partners? And then I just wanted to flag that I know the census tract is such a great place to go to for a lot of information, but we know there's a lot of challenges to that as well. And I think we should purposely, understand that that's not the perfect tool, and especially when there's this huge narrative around citizenship questions and all these, it just sets such a bad precedent for people to actually participate in gathering and sharing information through that avenue, that we have to recognize that that's not the perfect tool either. And what does that mean, right, for the environmental justice task force collecting information as well?
Yeah, absolutely. Yeah, some very important considerations. Any other thoughts on this specific question about who else should be brought into the conversation before we move on? All right. One other question that I had, I know that we have about 10 minutes to wrap up here, and this is a little bit more of a big question, and something that we likely won't have a lot of time to get to. But I think one thing that we want to think about is just creating measurable goals for not reducing, eliminating health disparities, as we've wanted to update the language. But when we think about creating measurable goals, what are we thinking about here? Specific locations? Are we thinking about health outcomes versus pollutant load? And so we kind of wanted to open that conversation up in our last few minutes to see, if there's any immediate thoughts around that, about when we say measurable goals for eliminating health disparities, how do we narrow that? How do we, what are our parameters here? And again, this is an ideation. This is not, I'm not expecting people to have the answers. There are no wrong answers. So just thoughts that people have.
I'm an architect, I'm a designer. So I always like to come to things as from that design perspective. And I once heard this amazing analogy of somebody that designed a peeler for a potato that was designed specifically with for people that have the disease that their hands shake a lot. And they designed it for that specific individual. And then from there, everybody was able to use it. So it was designed for the person that had the most challenge using a tool, and then designing it from that lens helped absolutely anybody from that spectrum to fully able to use any tool. So I would just like to think about, how do we design and how do we start with the people that are impacted the most? And how do we think about, start setting regulations for the communities that are the most burdened? And that we find that have the most cumulative impacts of environmental justice. And I'm pretty sure if we can design tools for those communities, all communities that have less burden will benefit automatically when we start from that place. But again, that's just kind of from an aspirational design point of view.
Yeah, that's a great example to bring up. And I was talking about this recently with somebody else too, about those sidewalk curbs, originally created for people, for accessibility of wheelchairs. And now I think it was a national survey, and I think it was 70% of people will prioritize getting to that kind of sidewalk, whatever it's called, that divot in the sidewalks, helps people with strollers, people on bikes, and it's it's had a huge ripple effect. So yeah, definitely hear you on that. Any other thoughts around that, about kind of narrowing the scope of measurable goals, specific locations, thinking about health outcomes versus pollutant loads? How do we want to narrow this?
That is such a really big lift. It's a really big lift because you're thinking in terms of a metric that you can tie specifically to something that you've changed or something that you've eliminated or removed or improved on, and then you're trying to think about like a measurable outcome. So I'm going to try and get my head out of the health side of it, you know, like if you set like just a goal of winterizing homes or something simple like that, you know, improve the housing stock or something, you know, that kind of thing you're thinking about. So like you set a goal and say this year we want to improve such a percent of like the housing stock that we have, to weatherize it, or to get X amount of homes with solar panels on them. Or is it more like reduce hospitalizations due to asthma exacerbation, you know? So it's like such a broad range of different things.
Right.
The kind of where you're trying to go with that.
Yeah, yeah.
I think so. For me, the way I look at it, so then it rolls back to the community that we're trying to serve. You know, what is it? What changes do they want? Before, you know, for us to sit here and say, well, I'm very good at giving great ideas, but the community is the one that, and they're all different, and so the community itself is the one that should really say these are the things that are concerning to us. And then from that, we can kind of start narrowing down what measures we need to start really thinking about more seriously than just starting with this like really broad universe.
Right.
Yeah.
Yeah, thanks for taking us back to that, Uni. And so, you know, with that, that is kind of a little piece of homework that I would imagine for our task force members and even, you know, others who are participating in the subcommittee, in thinking about who else you want to bring into this conversation. These meetings are posted publicly. And so if there are folks here, if there are folks that are missing from this conversation, you know, how can we get the word out? How can we get them here in this space to kind of really share what they want to prioritize? In the last few minutes that we have, one thing that we do need to get to is electing a chair. We have 2 task force members present, and I just wanted to see kind of if between Beatriz and Uni, if there is interest in being chair of this subcommittee. We can definitely ask Dr. Davis as well. But Uni, I know that you had expressed before that you may want to help lead this data and health disparities subcommittee, and I wanted to see if there's still interest there.
Yeah, I had volunteered because I kind of felt bad because a lot of the original task force members are in so many different subcommittees, and I was like one of the only ones who just picked one because I know where my bandwidth is, and so that's one of the reasons I volunteered to kind of help shepherd this cause.
And is that something that you're still interested in?
Yeah, I still am. Okay. Interested in this.
Great. And Beatriz, is there any, okay, you vote for Uni. Okay, cool. So I think we need to just like do a formal vote. And so if we could have one of you, Uni or Beatriz, motion to take a vote, and then cast your vote and say yay or nay.
I move to vote for Uni as the chair of the data analysis subcommittee for the Environmental Action Task Force.
So do I second, what do I say? So I second myself on that one. There's no conflict of interest in that statement over there. Okay, just making sure. All right.
And what do I say? All in favor, say aye.
Yeah.
Aye.
Awesome. Okay. Great. So thank you to our task force members for electing a chair. Congratulations, Uni, for being the chair of the Data and Health Disparities Subcommittee. We're so excited to have you. Awesome. And so then in terms of next steps, this is just so we have something to look at. But, you know, this is a work in progress, but a couple of things. in terms of homework, please do continue to tell us who you want to bring into these conversations. And, you can invite those people directly, or, email us and let us know, hey, can you contact these folks? For the next meeting, I will work with Uni to develop an agenda, and we'll kind of walk through a timeline for how we will continue working together for the next few months. And then for us, for the EJ unit staff, we will work with Uni and Beatriz to kind of look at the inventory of data sets and kind of share some summaries around that, successes and limitations that we've found. There are about 12 pages of notes. Thank you, Joel, for taking ample notes, but we will kind of go through that, and there'll probably be a number of other next steps that we will continue to share with you all. I think this is an incredibly productive meeting. Thank you all so much for sharing your perspectives and all of your thoughts. Let's definitely keep the conversation going. If you have other additional thoughts or ideas, or things that wake you up in the middle of the night, email me with those ideas. We would love to hear them. We'll keep you informed about when the next subcommittee meeting is scheduled and post that publicly. And thank you all again for your participation. All right, have a great rest of the day, everyone. Thanks a lot.
Thank you all.
Thank
Bye.
you.